Thanks for inviting us in. It's now 11 o'clock, and we begin this evening following a pair of breaking news stories. Just moments ago, the United Auto Workers president announced a tentative agreement with Rolls-Royce here in Indianapolis. I'll have more on that for you coming up in a moment. But first tonight at 11, a defendant investigators say skipped out on court while awaiting a jury verdict is dead tonight of a suspected self-inflicted gunshot wound. The man was out on cash bond. Now, according to the Marion County Sheriff's Office, he left the community justice campus and didn't return. In the last hour, the Sheriff's Office confirmed investigators found the man's car at an apartment complex near 30th and Keystone. Sheriff's deputies say the man was barricaded inside of his apartment. Officers tell us they made several attempts to get him to surrender, but when they got inside, they found the man with a gunshot wound to his head. He died at the hospital. IMPD will now lead that death investigation. And now to that UAW deal. President Shawn Fain here in Indianapolis tonight addressing his union on social media. Members rallied earlier this week across from the Rolls-Royce facility here in Indianapolis where they manufacture aircraft engines. So I want to show you a quick look at what's in this tentative deal. Fain says they have now secured what he calls a healthy wage increase, saying everyone will now get a cost of living allowance. Fain says they've won back true profit sharing and gotten members more vacation days and better retirement benefits. And now the union members will have to vote to ratify that deal. Now we're going to follow both of these stories very closely for you. You can find any breaking developments tomorrow morning on Sunrise starting at 4 a.m. Angela?
Scott, it has been a stormy night, especially south and east of Indianapolis. So we'll start with live Doppler 13 radar, still tracking some heavy rain moving out of North Vernon over toward Versailles, just south of Brookville. This is the last of it. So as we move into the overnight hours, just a mainly cloudy sky, but we will dry things out. So nothing weather-wise to slow you down early on a Thursday morning. Grab the jacket, temperatures in the upper 30s and low 40s. Not quite as warm tomorrow. A spotty shower tomorrow afternoon, and highs near 50.
Angela, thanks so much. Tonight at 11, an investigative committee tasked with looking into harassment allegations against members of Mayor Joe Hogsett administration and campaign met again. They discussed the first report on this investigation. Our Logan Gay was there tonight and shares where things stand and what's next.
The committee listened closely after members from the contracted law firm Fisher Phillips laid out the progress of the investigation so far. It includes reviewing over 1,000 documents relevant to the accusations and the Hogsett administration's handling of them.
We discussed our collection and review of documents to date, interviews we have conducted with relevant witnesses, our analysis of human resources systems in other municipalities and counties, our review of the city-county's newly introduced anonymous reporting tool.
So far, 13 people have used that anonymous reporting tool, something that committee chair Krista Carlino says is a step in the right direction.
We know that from a human resources perspective, that anonymous reporting is really best practice when it comes to harassment. So it prevents retaliation and other, toxic work environments.
Right now, the investigation is in the middle of phase 2 of its 3 phases. Carlino says they're focused on making sure this investigation is handled correctly.
We're really leaning on our expert attorneys to make sure that all legal processes and procedures are followed, as well as sensitivity and protection and privacy are given to those reporters or potential victims that are involved.
Some people keeping up with the investigation may have been hoping to get more answers tonight and may be disappointed as many of the questions from the committee went unanswered.
Do you feel like the administration's been transparent and forthcoming with you all?
As our investigation is ongoing, you'll probably expect I'll say this. We're not forming an opinion or disclosing that at this time. That's not to say yes or no in any way.
While the community waits for answers, Carlino hopes everyone remembers they're dedicated to getting them.
Know that we are trying to do our due diligence, not only to keep the investigation independent and transparent, but also making sure that we are communicating and doing the work that we set out to do, and that is to make the city a safe place for all who come and visit as well.
At this time, there are no committee meetings on the calendar, but Carlino says her personal goal would get a final report by June 1st. In Indianapolis, Logan Gay, 13 News.
Tonight, 13 Investigates has an incredible story about an Indiana woman denied coverage for life-saving medical care. That woman survived because paramedics acted quickly, but her insurance company told her everything happened too quickly. Our senior investigative reporter Bob Siegel explains what happens next and why it raises big questions about how all of our medical claims are handled.
You want a treat? You want a treat?
Amanda Boley says she had just taken her dog for a walk when her life turned upside down.
Sat down, was texting, laughing with some coworkers. My dog was acting a little weird, and I looked at her and said, "What do you want?" And I kind of played with her a little bit, and then I was gone.
And you remember nothing after that?
I remember nothing after that.
Jefferson County 911. I need an ambulance immediately.
It's October 24th. Amanda had just collapsed. And Officer Kyle Pence is first to respond. A camera on her front porch shows emergency crews rushing to help Amanda after her heart stopped. Her breathing stopped. Essentially, everything stopped.
Don't let her die. Don't let her die.
Not conscious, not breathing.
Amanda, please come back.
I did not feel a pulse while I was there.
I love you, Amanda.
Amanda was in cardiac arrest.
Stay with me.
Paramedics and doctors quickly determined the only chance to save Amanda's life was to get her to a major hospital, the closest one an hour away. So they called in this helicopter to transport Amanda to Louisville. That's where doctors implanted a defibrillator in Amanda's chest to restart her heart. She remained unconscious for 2 more days.
Next thing I know, I woke up Saturday in the hospital. I had IVs everywhere, out my neck, my arms.
Had they not flown you by helicopter,
I'd be dead.
that was truly a life-saving decision.
Yes, I'd be dead.
So imagine Amanda's surprise a few weeks later as she was reviewing all the bills paid by her insurance company to find one bill denied. It was the bill for emergency transport in that helicopter.
They were denying the claim because it didn't get pre-approved.
You heard that right. Anthem Insurance told Amanda it would not pay for the air ambulance because this service requires pre-approval. And the company said, your plan doesn't cover this service without it. You are responsible for this amount.
$64,998. I cried. I felt sick because how am I going to pay that? And then I decided, well, I'm going to look at my policy. And my policy said pre-approval may be required. And so then my thought was, dry the tears. Okay, this has definitely got to be something that doesn't need pre-approval.
So Amanda sent Anthem details and documents about her dire medical condition, all showing she was most certainly suffering from a life-threatening emergency that justified the helicopter and that rendered her unable to get pre-approval. But all that paperwork from Amanda did not work.
I appealed, and they denied, and I appealed, and they denied.
That's right. Anthem turned down her appeals, not once, but twice, keeping its previous decision and insisting Amanda's claim was processed correctly. Anthem said air ambulance services are subject to medical necessity reviews by us and will only be covered when approved in advance, before services are performed. There is no pre-authorization on file approving this service.
That night I was dead, and then I was unconscious. I don't know how I'm supposed to get pre-approval.
She was in no way, shape, or form able to call to get pre-authorization. She was unresponsive.
I don't have $65,000 laying around. I don't know many people that do, and I just think it's going to financially devastate me.
That is when Amanda called 13 Investigates, and we contacted Anthem to find out why in the world an unconscious patient in cardiac arrest would need or even be able to get pre-authorization for a life-saving helicopter ride.
Anthem would not meet with 13 News to talk about this case, but the company did send us a statement saying it completely messed up. It's a long statement, but it's important, so I want to read you most of it. Anthem says, emergency treatment never requires prior authorization, and our members can access emergency services 24/7 at any facility, regardless of network status. In this case, coverage decisions were made without the necessary information from the provider to recognize that this was an emergency. Once we became aware of the circumstances, We should have acted immediately to obtain that documentation and approve the claim, but we did not. We deeply regret the mistakes that led to the incorrect determinations, and our leadership team has been in touch with our member to offer our sincere apologies. So, that $65,000 bill, Amanda doesn't owe that anymore. But the way this case was handled raises some big concerns.
It doesn't even make sense.
Patricia Kelmar is with the U.S. Public Interest Research Group, which tracks public health issues affecting consumers. She says there are news stories every day of patients just like Amanda battling big insurance companies over improper denials.
It seems like a disconnect, and the patient is left with this huge bill. That can't be right. That's not how our system is supposed to be working with insurance.
An estimated 450 million health insurance claims are now denied each year. That number is growing, and some consumer watchdogs worry it's because decisions are being made by computers, not by people.
We know right now that insurance companies are using AI to deny claims. These are individuals who have medical records, medical histories that may not fit into an AI model. And so it's important that there's a real human being that's looking at this information and making those claim denial decisions.
Was artificial intelligence used to evaluate and repeatedly deny Amanda's claims? Or was it a human being who made those mistakes? Anthem has not responded to that question. Either way, Patricia says when medical claims are denied, patients should fight.
They should certainly appeal. What we've seen in studies is at least 50%, and there have been reports of even as high as 75% of the time, patients will win that appeal.
Good girl.
Amanda says in her case, an appeal never should have been necessary.
It's appalling. It's outrageous. When people need help in a crisis situation like that, they have insurance for a reason. It's to help when those situations happen.
Following this investigation, Anthem tells me it's now revisiting staff training and what the company prints and documents to help prevent mistakes like this from happening in the future. What can you do if your claim is denied and if your appeal gets denied too? We have tips for you at WTHR.com. I'm Bob Siegel, 13 Investigates.